In health news, the public health emergency status of COVID ends in America next week. And global health experts are meeting this week to decide if the World Health Organization will also end its emergency designation for the COVID pandemic. So to explain the implications of all of this and the current status of COVID, we are joined by our medical expert, Dr. David Winter from Baylor Scott and White Health. So first off, Dr. Winter, is COVID still the threat to all of us that it used to be? I mean, are there still lots of cases out there?
Yeah, Megan, this past week in America, there were 88,000 new cases. That's about 12,600 a day. So there's a lot of it out there. Now, that's less than it was a year ago. And most of those are mild. So that's fortunate right now. There's a new variant out. We talked about this last week, XBB.1.6. So for that looks to be mild. So we're watching that very carefully, make sure it doesn't get worse. And the next mutation is what we worry about. Could the next one be even worse, cause more serious disease? But there's still plenty of COVID out there right now.
Yeah, and at this point, we're almost used to it, and at least used to the rhetoric around it. But what will it mean when this public health emergency designation goes away in America?
Well, in America, federal workers now have to be vaccinated, so that'll go away. And if you're not an American citizen, want to fly into America, you have to have vaccination records. That'll go away. For the rest of us, though, I think the main thing is that federal funding for the testing, for the vaccines, for the treatments, that's likely to get less or go away completely. So it's going to cost a lot more money for us to treat and diagnose and test for COVID in the future when this public health emergency goes away.
Yeah, absolutely. And let's broaden this out here, because you mentioned that the World Health Organization will meet to consider terminating public health emergency status for COVID worldwide. What are the implications of that?
Yeah, the concern there is that global funding and collaboration among all the countries, that may lessen at that point. Now, individual countries can still keep doing what they want to, but I think that'll disadvantage some poorer countries. That may be an advantage for the coronavirus in with less attention, less testing, and less treatments.
Absolutely. And so what do you see down the road for us? I mean, is it possible that COVID could remain mild for most of us, or at least become less of an issue?
I think it's clear that this virus is going to hang around. It continues to mutate, continues to change. Lately, all the mutations have been mild, but the next one could be serious. Just like every 10 years, influenza is bad. The other mutations of influenza yearly are not that bad, but I think it'll be somewhat like that. We do know that if you've had COVID before, you have some immunity, but this study just came out saying that if you've had a vaccination, you're 3 times more immune than with COVID itself. So I feel like, just like influenza, we get a flu shot every year if we want to protect ourselves. If you want to protect yourselves from COVID, you'll probably need to get a COVID vaccine on a yearly basis.
You know, and similar to influenza, similar to what we've seen over the last 3 years with COVID, are there specific symptoms with this strain of COVID that people should look out for if they may be feeling a little under the weather?
Yeah, that's a good question because the new strains have different symptoms. You know, when we first started out, it was loss of taste and smell. That doesn't happen anymore. The new variants that have come out recently actually mimic a lot of the stuff that's out there with the common cold, with influenza, even with allergies. So it makes it more difficult for physicians and patients to figure out what they have. So I encourage anybody with any kind of mild upper respiratory symptoms, get a test. The testing is pretty good, particularly if you get a second test of the rapid test at home 2 days apart. If that's negative, you don't have COVID.
All right. I'm so happy that we're still talking about this, Dr. Winter. Thank you so much. Appreciate it and appreciate your time.
Thank you, Megan. Have a good day.